สวัสดีค่ะ and good afternoon. Today is Sunday, the 25th of April, 2021, and welcome to the English language summary of the daily press briefing on the COVID-19 situation, live from the Center for COVID-19 Situation Administration, or the CCSA. Today, again, we have some very grim news as repeated before earlier by Dr. Tui Sin. I'd like to start with the general situation by reporting on the number of cases. You will see today that we have the new number of confirmed cases standing at 2,438 cases. Of this number, there are 2,151 cases which are local transmissions. There are 282 cases from active case findings and 5 cases from state quarantine. So that leaves us at with the accumulative cases of confirmed COVID at 55,460 cases. We have today new recoveries standing at 547 persons, and this leaves us to a total number of recoveries at 31,113 persons. We now still have a number of 24,207 active cases that are being treated in medical facilities. In those medical facilities, we have 507 cases who are in critical condition and 138 cases who are on ventilators. And I'm sure I speak for the nation that our hearts and our prayers are with those who are in critical condition, and we hope that they do very soon recover from this very severe and very troubling disease. Dr. Tui Sin also reported that on the new fatalities that we have today, we've reached, I'm very sad to report, we've reached another new high. We've got today 11 new fatalities. And that leaves us with a standing accumulated total of deaths at 140 persons. So to talk about the details of the new fatalities, the 130th fatality was a 27-year-old male from Bangkok who already had pre-existing medical conditions. He was diagnosed with diabetes and obesity. The 131st fatality was a 34-year-old female from Pathum Thani province who also had pre-existing medical condition of sinusitis and obesity. The 132nd fatality was a 69-year-old male from Pathum Thani province with high blood pressure and gout. The 133rd fatality was a 62-year-old female from Sukhothai province who also had a pre-existing medical condition of high blood pressure and hyperlipidemia. The 134th fatality was a 70-year-old male from Prachuap Khiri Khan province, and he was already a bed-bound patient with diabetes and chronic kidney disease and also high blood pressure. The 135th fatality was a 45-year-old male from Nakhon Phanom province with diabetes, high blood pressure, hyperlipidemia, and obesity. The 136th fatality was a 35-year-old male from Nakhon Ratchasima with obesity. The 137th fatality was a 34-year-old male with diabetes and obesity. The 138th fatality was a 36-year-old male from Bangkok. The 139th fatality was a 35-year-old male from Bangkok. And the 140th fatality was a 30-year-old female from Bangkok who was very tragically 25 weeks pregnant. So we can see that almost all fatalities had previous histories of pre-existing health conditions such as obesity, diabetes, high blood pressure, and chronic renal or kidney disease. And on behalf of the CCSA, I'd like to express our sincerest and deepest condolences to the families of the deceased, and we hope that they will find strength and resolve to carry on during this very difficult time. We also have today some observations that Dr. Tuisin had just earlier reported. Today, the CCSA met again this early morning at the working level, and they discussed the analysis of the 3 COVID outbreaks that Thailand has experienced since 2020. So the first outbreak that the meeting discussed, we found that the accumulative number of cases during the first outbreak, which was counted from the 2nd of January to the 14th of December 2020. So the whole cumulative number of cases was 4,247 cases. The median age of those infected was around 36 years of age. And they also belong to the working age group. And during the second outbreak of infection, starting in December 2020, the accumulative total cases was 24,626. These are also with the median age of infections at 32 years old. And the accumulated cases was counted from the 15th of December to the 2020 to the 31st of March 2021. The third outbreak, the current outbreak that we are currently experiencing, we have now a cumulative total of cases starting from 1st of April until today, as I reported earlier, standing at 24,159 cases. The median age of those infected is at 29 years old. And so from these 3 outbreaks, we can see that the median age of those infected has been reducing. This means that this particular outbreak has affected mostly younger people. And so this means that we hope that the younger people will refrain from movements or traveling around and try as much as possible to stay at home to avoid any more increased risks. Dr. Tuisin also addressed some questions from the media. He talked about a currently circulated news that we can negate and say that this is fake news. There was news circulated in the internet regarding some chartered flights from India, leaving India to Thailand, and also other countries to seek medical or even to flee from the country because in India they've reached their maximum capacity of treatment for COVID patients. So we can negate and say that this news piece is false. Our embassies and consulates general in India have confirmed that we have never issued any certificates of entries for such Indian nationals to enter Thailand. And Dr. Thuisen also mentioned that, so particularly for India, on the 1st of May, starting on the 1st of May, flights from India and from Thailand to India, from India to Thailand, are only to be arranged as repatriation flights. They are to be only for Thai and Indian nationals who have requested to return to their respective homes. So, starting on the 1st of May, we will not be issuing any, we will delay the issuance of COEs for foreign nationals who want to travel in between Thailand and India. And of course, he can say right now that in the month of May, only 4 repatriation flights have been arranged for now. Also, to report on the top 10 provinces that have highest number of COVID cases, Dr. Thuisen also said that Bangkok again is number 1 in the top 10 list with 1,078 cases. Chiang Mai has 163 cases, Nonthaburi 115, Samut Prakan 77, Chonburi 75, Pathum Thani 56, Nakhon Si Thammarat 55, Nakhon Ratchasima 54, Surat Thani 54, and finally Samut Sakhon with 52 cases. On other measures, I'd like to report that yesterday the Prime Minister released a public statement on his initial orders to strengthen the capacity of the public health system to cope with a new wave of COVID in the country. And these are the following orders from the Prime Minister. So, to tackle the care and treatment of COVID-positive patients with the increasing number of patients, he has ordered all agencies to prepare additional beds that are of hospital standard in terms of treatment and medical care to resolve the urgent issue about the roster of hospital beds in the Bangkok area, which are currently near maximum capacity. These management systems will be integrated with the current patient administration, they will be integrated with the current patient admission system in peripheral areas of Bangkok. Also, he's instructed that agencies should contact all patients that are awaiting medical treatment in hospitals. As of yesterday, there are 1,420 patients, and they are to be directly contacted, and they will be prioritized by the severity of their symptoms to receive medical treatment as soon as possible, and they also will be sent to hospital at the earliest opportunity, and the wait should not exceed more than 3 days. And also to increase the maximum capacity of hotline numbers, the Prime Minister has instructed to do our utmost to increase this capacity to accommodate the increase of requests and number of potential patients. He's also instructed all agencies and also the private sector to synchronize the efforts being made about testing facilities and public facilities as soon as possible. So they will start by moving COVID testing facilities to field hospitals instead of using the current hospitals that are treating COVID patients, so as to minimize large public gatherings. And those who are tested positive will be contacted via telephone or telemedicine channels to determine the severity of their symptoms, and they will be accorded arrangements to be picked up and sent to the hospitals as soon as possible. He's also instructed to increase the number of public health worker volunteers and officials who are being seconded from private sectors as well to help in public-related operations. And he's also instructed to help to reduce the number of quarantine days for the asymptomatic group from 14 days to 10 days. These are for the patients who are currently being quarantined. They will be followed up by strict quarantine at home with stringent track and trace systems so that patient beds can be turned over faster. Also, on measures to control the outbreak, we will be intensifying public health measures to stem the spread of COVID in all provinces, in accordance with the situation on ground as deemed necessary by the governors of the province, including the temporary closure of venues as appropriate. There will also be the possibility of the closure of venues in different provinces as necessary. And the public is also asked to refrain from leaving their residence at certain hours, bearing in mind the impact of these measures and also risks. And so the Prime Minister himself will oversee the implementation of these measures to make sure that all efforts are being made with highest efficiency. And of course, the safety and the security of all the people in the country is given the highest priority. Also, I'd like to update you of measures that Bangkok Metropolitan Administration has implemented effective as of 26th of April. They've ordered for 31 types of venues in Bangkok to be closed. And these you can find on our social media pages as well to recap. These are cinemas and theaters, water parks, amusement parks, zoos, skateboarding parks, snooker and billiard places, bowling and video games, arcades, game shops, public swimming pools, exercise facilities, museums, public libraries, nurseries, exhibitions, convention centers, and most of them are they have to do with entertainment, and some service venues, shopping malls have been also reduced business hours. They are to start from 11 a.m. to 9 p.m. Beauty salons, hairdressers can open, but no one can wait inside. All types of sporting fields are closed. Public parks are also closed. And convenience stores can open now only from 5 a.m. to 10 p.m. And lastly, there are no meetings for more than 20 people at a time. And most importantly, compulsory mask wearing measures are now in order. So anyone in public areas found without wearing masks will be fined at 20,000 baht. And as I said, this order will be effective for 14 days, starting 26th of April, that's tomorrow, Monday, until the 9th of May, 2021. So, I'd like now to end on a note, more positive note. Before I end, I'd like to give out a shout out to many of our foreign embassies in Bangkok who have helped us relay the information that we provide at our daily briefings to the expat community. We hope that you can continue to engage with your fellow compatriots and make sure that all the vital information about public health and disease control measures do reach out to each and every person in the country, regardless of their language barriers. The cooperation in complying with our measures is crucial at this very important and trying time. And we will continue to do our part to make sure that you are always on the same page as us. That's all I have for you today. Thank you very much for your kind attention. Have a happy rest of the Sunday and see you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ
กราบขอบพระคุณค่ะคุณ